overdose or he will bleed if you take too much drugs. So that we are now advocating surgical skill in valve repair in children. Every child should have that access to valve repair. And you can also do that when you train the locals. Now we have organized international training program in Ghana. Last year we invited surgeons from Uganda, Namibia, Nigeria, of course Ghana, and to come and learn how to repair a valve in a child instead of replacing it. And this is very important for our later. Well, if it comes to the communicable disease, many people are not aware that a communicable disease like tuberculosis can also cause heart problems. See? And that's what we call the constricting. The heart membrane will constrict in such a way during the healing process of the tuberculosis, and constrict the heart, and that the patient can die not from tuberculosis but from this constricted membrane of the heart. And this is what we have to know. The same like also the HIV associated heart disease is also there. It's also well known. Well treated HIV can also bring another second disease, and we have to prepare to save these people by getting a coronary artery bypass operation, because this is the complication of such a problem. And I would like to just give you one of our major important results. During our cardiology training program, we realized that Ghana has only one pediatric cardiologist for the whole 30 million. One, and 14 adults. So we started training many physicians, pediatricians, how to use echocardiography, the heart ultrasound, in order to diagnose heart. And within 2 years, we were able now to train. We had our 12 tutors from Germany and South Africa. And within 2 years, we could now, these are the training program sessions would go on, even two colleagues from Nigeria. And within 2 years, you can see we have increased the pediatric cardiologist density now to 14, from 1 to 14, and adults from 14 to 27. See? And this is a very, very important message that we have to know our problems and see how we can tackle the problems. We have the potentials are there. We have the missions and also the capacity from outside, either from outside or from neighboring countries, which can help in developing such a program. And with our programs, now that we have such a big and stable program, as I told you, over 5,000 children has now been screened for rheumatic heart disease. We have done about 220 children patient care, and in the media, we have about 2.2 million people which could be reached by numbers in order to know that these problems are what we are doing, and that the problems on healthcare and cardiovascular care and the awareness and how to deal also with such problems. The last important issue is financing the universal health care coverage. It's also very important because we don't. There's always out-of-pocket payments. See, over 60 to 80% of many countries do out-of-pocket payments, and how are you going to solve them? And I think the only way is to see how we can generate funds from within the country or within the communities. If you take West Africa, for example, 9 million diaspora are from West Africa in the whole world, globally, and they, for example, send $26 billion every year to West Africa. Yeah? And Nigeria alone, about 20 billion. And that means if we're able to organize the diaspora, they can partly use their funds in terms of health insurance scheme in order to help even their own relatives or their own communities. And this is what we have to also address for the South-South Development Cooperation and see how we can organize such healthcare insurance system community-based. So the possible solution, as I've told you now, we are now trying to develop Wiki, they call it, which aims at activating the West African diaspora towards this scheme. My son, who is biotechnologist, is involved in this program, and we hope very soon that we will get also some stakeholders to develop such health insurance system. And our proposal for ACP is how to transfer exchange of knowledge in the area of hospital services, public health, and specialized fields in terms of hospital partnership programs. And we need, of course, health science, digital technology, education in order to achieve such aims, and also guidelines for policymakers. We can only use that when we have also our data and experience. Our expert consultations will also promote and support strategic plans for suitable sustainable development in cardiology, intensive care medicine, cardiac surgery, and also communication technology. And my last presentation will be to have a network with the ACP health ministers and senior health officials so that we can form a collaboration and a dialogue which also has incentives to strengthen the South-South and triangular cooperation in collaboration with the European Union and African Cultural Institutes. So I will summarize that a comprehensive risk factor evaluation of our screening programs and projects are very important, using the target blood pressure, for example, of 120 to 80, using ultrasound diagnosis tools for early detection of and early treatment of heart disease, hospital partnership programs to coordinate and facilitate effective prevention treatment programs, and health insurance schemes in the context of collective community action. Thank you for your attention.
Thank you, Professor Yanka, for this very comprehensive and rich presentation. As I listen, I think there are a lot of takeaways that we can take this afternoon. And indeed, you are a professor, but also a surgeon by practice, as we learned from your CV. Professor, thank you so much for your PowerPoint presentation and for the experiences that you have shared from your side, speaking on Ghana's experience. I think one key item that we are taking out from this PowerPoint presentation is the healthcare that being funded by out-of-pocket in most of our African member countries, and you mentioned very interesting statistics of 60 to 80%, and I'm sure that your presentation also spoke to how we can address some of these issues, and not just in Africa, but also looking at the other ACP regions in the Caribbean and the Pacific. Thank you, and may I now invite Dr. St. John from the CAPA. She's the Executive Director of the Caribbean Regional Public Health Agency. Thank you, Dr. St. John.
Thank you very much, Chair, and may I thank Secretary General Gomes for inviting CARFA to present. And I've really enjoyed the discussions previous to this presentation. And so in my presentation, I'm going to give you a little bit about CARFA, because I'm sure most of you don't know a thing about it. And then I'll give you some insight into the technical cooperation that we have been giving to our 26 member states, some ideas of NCD-related work, both in prevention of NCDs and treatment, a glimpse of the partners that we have had, and then a little more focus on the partnership we have had with the ACP group, and a teaser into possible future collaboration with the ACP group. So CARFA is the merger of 5 regional health institutions, and I'm talking about the region of CARICOM in the Caribbean. It was established by an intergovernmental agreement in 2011 and became operational in 2013, headquartered in Trinidad and Tobago, with campuses in St. Lucia and Jamaica. The strategic plan is aligned to the Caribbean Cooperation in Health, the fourth iteration. And you will realize from much I will say going forward that the way in which we deliver technical assistance to the Caribbean is that we try to do health system strengthening in all of our member states within the framework of functional cooperation in health. The 5 regional health institutions dealt with environmental health and environmental management, surveillance, research, nutrition, and drug testing. And so we have an unusual remit for a public health agency, quite broad, but it's been working. The technical cooperation to the member states that we have done in the area of NCDs, I will focus on NCDs. There's a long history of regional guidelines, and most recently we have done regional guidelines in collaboration with the Organization of Eastern Caribbean States in diabetes. Of course, there's capacity building, and of course, the surveillance functions, cancer, nutrition, and hypertension, and diabetes management. So here are some prevention interventions, best practice interventions. First, we have the CARFA 6 policy point package, and we have worked with other CARICOM institutions to have intersectoral and interagency collaboration. We have also worked at the political level of CARICOM, and have had a joint Council of Ministers and Health Ministers and Council of Trade Ministers initiative, where intergovernmental working groups are going to be working jointly on looking at the trade and other issues that can be amended to make sure that there is a more conducive environment to healthy eating. The 6 PPP also focuses on reducing childhood obesity and school nutritional guidelines. We're also currently working on a regional framework for salt reduction, CESA, and a regional framework for the reduction of abuse of alcohol is being developed, and these are all multi-sectoral actions. Also continuing with prevention, but now going into the exercise realm. We have been working with the Caribbean Development Bank to implement Caribbean Moves, which is promoting healthy lifestyles. It was launched at the UN in 2018. The CARICOM heads of government have adopted the initiative, and it is being implemented in countries in the region, not only by events, but through the work with the Caribbean Development Bank. We will be institutionalizing the whole healthy lifestyles framework. Surveillance, as the previous speaker said, this whole issue of data and information is critical. And so we are working on developing an integrated surveillance strategy so that we have the 15 data streams that we have in CARFA will be integrated not only to reduce the reporting burden, but also to make sure that there is integration of the CARFA member state systems with the CARFA system. Out of that, there is going to be the development of a regional NCD surveillance system. Again, a focus on reducing the reporting burden. Of interest is that CARFA is the site of one of the IARC CARFA cancer registry hubs, and we are one of 6 hubs around the world, and countries within the CARICOM region have been feeding information into the hub. Another important initiative that we've been working on is the development of cascades of care for hypertension and diabetes. On the far left of each of those graphs, you will see a dark bar. That refers to all of the persons who have been diagnosed with either diabetes or hypertension. And the whole idea between about the cascades of care is that we would try to reduce the gap between those who have been diagnosed and those who are controlled, which is the smallest bar, the lightest bar in each of those two graphs. And you will see that there is quite a gap between those who are diagnosed and those who are controlled in care. So we've been working with the member states, 7 in diabetes and 10 in hypertension, to improve their systems so that those cascades of care can have a reduction in the difference between those diagnosed and those controlled. But we cannot have any progression in the non-communicable disease area without the involvement of non-governmental organizations. And before you, you will see a range of initiatives that have been going on with the very active non-governmental organization space that occurs in CARICOM. From expanding access to cervical cancer education, to the support for diabetes foundations in countries, tobacco prevention, building alcohol awareness. And so the NGOs in the Caribbean space are not only about advocacy, but they're also about supporting other NGOs and strengthening other NGOs. And the NGOs in the Caribbean space are very important partners for CARFA. And here are some of the many other partners that we have had through the Caribbean Cooperation in Health. Some of you may not see all of them, but I'll name a couple. A major partner is CARICOM Secretariat. Yes, it is a political organization, but it does a lot of member state support as well. Then we have many of our CARICOM sister institutions, the Caribbean Examinations Council, CAFSA, SEDEMA, to name a few, and then the usual international development partners, IDP, PAHO, DFID, AICA, and of course, I won't forget ACP. So let us look at the partnership with ACP. And through ACP, CARFA has been the recipient of 11th EDF funding for a Zika project. Now, we do not have Zika circulating in our member states, but the vector for Zika, the Aedes aegypti, is a vector for many other vector-borne diseases such as yellow fever, chikungunya, and dengue. And so the support that we are getting is going to be used for vector control and reducing the unfortunately high burden of vector control, vector-borne diseases. So thank you very much, ACP. So what might we have future collaboration with? So I've been focusing on NCDs, not just because it is the main burden to member states, health systems, and also a huge burden to our citizenry and reducing productivity in our citizenry. And so I think this would be a nice area to collaborate in the future with the ACP group, especially as I hear it's transitioning. So work around NCD prevention and control, the sharing of regional best practices, and knowledge sharing to be part of the community of ACP, a community of practice, are some of the areas that I think would be good for future collaboration. And on that note, Chair, I end my presentation.
Thank you so much, Dr. St. John. Another rich presentation indeed that continued from the other presentation we had from Professor Janka. I think we can only agree that so privileged this afternoon to be surrounded by these doctors and professors who have been able to provide us some very insightful presentation, picking on the experiences that they have and also speaking based on their qualifications on the work that they have been doing in the region, focusing in Africa and also in the Europe with WHO, and recently now, as we've just heard, in the Caribbean region with the headquarters in Trinidad and Tobago. I thank you so much, and before I open the floor, I have asked Dr. Mullenberg to provide an overview. Perhaps she can also introduce herself in case we wish to have some questions picking on the presentation that was made earlier. After this, then we will have questions and observations from the floor. Thank you.
Thank you very much, Chair. And I apologize for not taking the floor earlier. I feel it always a bit difficult to speak immediately after my Director General and to add something to him. I think he is very comprehensive, so I don't want to do that. So I'm Lien Mullenbergs, and I'm the WHO representative to the European Union, and I had the privilege of being here before, but still I want to thank Secretary General Gomez and Your Excellencies to invite us, and especially to have a specially dedicated session in this very important meeting today on health and on universal health coverage partnership, on the universal health coverage, UHC partnership. I think this shows, from where I'm sitting, the importance that, thanks to your work, is given to health. And I can testify that is not always the case. As Dr. Tedros said, health is a political choice, and you obviously have made that choice. So I just want to add a few elements to what the Director General already mentioned. This UHC partnership is a partnership of the ACP countries together with the European Commission sitting here behind me. I always find it very nice to have the Commission backing me. Yeah, you should sit next to me. That would be easier, I think.
We are picking up.
Yeah, very exactly. But also, and through this initiative, it has also attracted many other countries. First of all, Luxembourg was one of the initial supporters of the partnership, but also other countries are coming on board gradually, and the partnership is really, really evolving. So WHO is actually only the, I would say, facilitator, because the partnership provides what I would call seed money to countries to help organize and strengthen their healthcare system in order to achieve universal health coverage and to attain the SDG goals around that. And I know the chair has asked me to give some objective, but I am very reluctant to go into detail. So I only want to mention a few elements, and the critical thing is that these partnerships and the way we work is tailored to the country. So it's not something which I can say in general, this is what we are doing. It's really tailored to the country, and Dr. Tedros is very, very firm. What we want to do is see impact at the country. It's not a general impact, it's at the country. That's where we are focusing on. We have started a new phase, and we have finished the inception period now, and I would be very pleased to come with my technical colleagues to present to the ambassadors of the ACP Secretariat at a later stage, eventually, the more in-depth overview of what we are planning to do for the next 3 years within this partnership. I'm offering that, and I would be happy to do that. But just a few examples of how we are working. For example, in Liberia, in Nigeria, and in Guinea, we are supporting the development of the workforce to address staffing issues in rural areas and to strengthen the capacity of nurses in obstetric and neonatal care. In Dominica, we work with the government on training additional community health workers to operationalize primary healthcare strategies. In Micronesia, we support access to primary healthcare services, to strengthening transport of primary healthcare teams and patients between the islands. In Samoa, we provide support to primary healthcare to address non-communicable diseases and specifically focusing on nutrition and obesity issues. I mean, I'm just naming a few examples to show you that it's really a tailored approach where we facilitate work between different partners really to bring and to strengthen health, the health system. Finally, I cannot stop without thanking very much, of course, the ACP countries and the Secretariat and the European Union to allow this, in my view, win-win collaboration between the European Union, the ACP, and WHO to progress more efficiently in this universal healthcare coverage agenda. Thank you, Chair.
Thank you again, Dr. Molenbeek, for this supplementary information and for your bullet point discussions on the work that WHO has been doing, specifically on countries like Liberia, Dominican Republic, Micronesia, and Samoa. Colleagues, I know we've had a set of very rich presentations from our panelists. I wish to now open the floor for those that have any questions or comments to make. Please raise your hand and give a brief introduction of your name so that our panelists can connect up with you before you pose any questions or comments. I think we have about 10 minutes, so I would suggest that we make it brief. I see Kenya. Ambassador, please. Sorry.
Yeah, thank you.
Burundi?
Yeah, let's start with Burundi.
Okay. Thank you, Ambassador. So we go with Burundi and then followed by Ambassador Kenya. Thank you.
Merci.
Thank you very much for giving me the floor. I'd like to congratulate the presenters for outlining this essential idea of universal health coverage. It really affects people's lives. I listened closely to the presentations and I carried out a comparative analysis with the situation in my country, which is an ACP one. And we see that there are many challenges. There is a serious problem which exists in our countries. For example, the lack of expertise. We are all aware of the fact that over 30 years ago there was a brain drain, particularly of specialists who went to train abroad and remained abroad, and that's where they're working. Whereas their country, their home country, doesn't have enough specialists. There are not enough people specialized in this area. If I take my country, Burundi, since the 1990s, there have only been 300 doctors who specialized, and they are still in France. Would you believe? They were sent to France to train, and they have remained in France. So I'm speaking about the many challenges, and there's a lack of adequate infrastructure for our countries. There's a lack of capacity in terms of primary and health care, the lack of equipment in terms of surgical equipment, etc. So it's a very difficult problem. The first presenter said that you needed to have quality care for everyone, and he's right. So how can we generate funds for countries, and ACP ministers must come together in order to find some solutions to the problem. So yes, there are many challenges to be taken up, and I think this can even go up
to the highest level, that is the ACP heads of state. The problem is there. Strategies are needed in order to find the appropriate solutions to come up with health coverage for everyone. It's very important. The challenges are there. They are difficult to tackle, so it's something which must constitute the highest priority on the global scale to find an urgent solution. Thank you.
Thank you, Excellency. Burundi, I see Ambassador of Kenya, and then we'll have Cuba. Thank you.
Thank you, Mr. Chairman. Again, very informative presentations. I want to start with Linda Maria, the presentation by our boss, who talked about gender equality in health services, which is important. So I want them to hear from her, what is the place of traditional healthcare providers in our countries? For example, traditional midwives. Sometimes the healthcare they provide is viewed as inferior, which is not true. Then Professor Yanka, you talked about how to heal the world. And one of your proposals is to change behavior. Changing behavior is an Herculean task. It's not easy. So what is your experience in Ghana and elsewhere? And you talked about several initiatives, healthcare education, screening program, but in all these initiatives, you have not given us the impact in terms of proportion, in terms of percentages, so that we can appreciate the impact that your interventions have had. So going forward, it would be nice to do that. You also mentioned that the database, having a database, medical database in Africa, and indeed in ACP countries, is a big problem, which we all agree. So where is the lacuna? We do research every other day. Yes, for masters, for PhD. Where is the problem? Is it the case that we don't publish locally or internationally? Where is the problem? And finally, Mr. Chairman, I wanted to ask a question related to school nutritional guidelines by our sister, Dr. Joy. You talked about having school nutritional guidelines, for example, which touch on obesity. I wanted to find out from you, what is a compliance like? It's one thing to have guidelines, and another thing for people to comply. So share that experience with us. Thank you, Chairman.
Thank you, Ambassador, for your questions and observations. I wish to invite Cuba, please.
Buenas tardes. I would like to express myself in Spanish. It will be better for me. I would like the interpreters to help me to pass the message. Buenas tardes a todos los presentes.
Good afternoon to one and all. I'd like to thank all the panelists in organizing this presentation. I'd like to thank them for the high quality of what they said and the very interesting subject being discussed in this room. It would be unfair on my part if my country didn't express some ideas and give some information on all that has been done by my people. Because yes, you have states and their wishes, but you also have the altruistic attitude of the people themselves and the people who express and show solidarity, because it's the people themselves who work with others and who give what they have. Cuba has a lengthy and long experience of cooperation starting in the 1960s, particularly as regards health, based on the principle of sharing the limited resources we have. It has lent technical and professional services to 68 countries in various sectors, inter alia, health, education, sports, and also we passed on our experience in preventing natural disasters. Even we even have been working on a culture project for the Caribbean region. Of the 168 countries to which Cuba has lent assistance, and of those countries, 48 belong to the ACP group. But health has not only been the area covered, but health accounts for 90% of the cooperation given by Cuba. And not only in terms of medicines, but also training of doctors. We have a school, the Latin American Medical School, which has trained over 74,000 doctors from 70 or so countries, and 30,000 of those doctors came from ACP countries. That training and those medical services were done on the basis of resources supplied by Cuba. It is noteworthy to see that the presence of Cuban professionals as part of WHO teams and other international associations, particularly in Armenia, Pakistan, following on the tsunami in Indonesia, the various earthquakes, and the cholera pandemic, and Ebola in Guinea-Conakry, Liberia, and Sierra Leone in 2014. So this is what triangular cooperation is all about. What is also worthy of note is the cooperation in other areas of health. For example, yesterday we developed a project with the Institute of Tropical Medicine, Cuba, together with other ACP countries, including the Democratic Republic of Congo and Belgium, is working or has been working for the last 2 years on a cooperation project, which is a triangular one, with the Institute of Tropical Medicine in Antwerp, in order to identify and study those vectors which transmit dengue, chikungunya, and Zika. In 2016, with a strong political will, but also given the availability of tropical medical institutes of those three countries, together with the wish of their specialists to tackle this plague, today we have positive results, not only relating to the interchange of experiences, but also the study and information. We have a very good results. There are other examples of cooperation in terms of risk prevention in the Caribbean, together with the EU. Cuba participates in this, and this relates to the transmission of experiences for dealing with climate change and its effects. It's a subject which is of concern to all of us, particularly the small island developing states. And in this case, the Caribbean. We are the most affected. Finally, this morning, much was said about conceptualizing South-South and triangular cooperation. May I state that Cuba, what we have done is to share what we have. So it's not only a matter of political will and inclusion of all stakeholders in cooperation. It's also important to highlight the fellow feeling to give what we have. It's the strong force of a nation which wants to pay off the great debt it owes to mankind. So let me finish by saying two things. The first thing is that the guide of our revolution, Fidel Castro, said that to be internationalist is to pay our own debt to mankind. and we are part of mankind. And if we are not capable of fighting for others, we will not be capable of fighting for ourselves. On that basis, our cooperation works. Cuba is not a rich country. It has scarce financial resources. And in addition, we are a country under embargo from the United States. But it shares its modest experience and best practices with ACP countries, as well as potential in areas such as health, education, risk prevention, etc., agriculture, sports, and including culture. I'd also like to say that there's a lot of bad things being said about Cuba's cooperation in health. But our doctors, as well as our nations and the various sectors, carry this cooperation with them.
Hello.
Gracias.
Thank you.
Thank you so much, Cuba. Colleagues, I'm sorry to interrupt. Professor, who has some questions and observations to answer to, is leaving in a minute. So thank you, Cuba, for that. May I now, before we listen to Excellency Ambassador Barut from Chad, who may have some comments or questions, please allow me to give this floor to Professor Yanka. Thank you.
May I answer? Thank you, Chair, for giving me this floor. May I answer some few questions from Burundi regarding the what you call it, out-of-pocket payment and then health insurance problems, probably in Burundi or in other parts of Africa. I believe that Ghana has a very basic, simple health insurance system, whereby every purchase, of everything, about 15 to 17% of the product is being charged for health, what they call a national levy, health insurance levy. I think your country can start with this as a first step. In order for the Burundi to generate its own funds towards universal health care. At least they can use this levy to support the primary health care system. And if you are able also to convince your diaspora to rally them to remit more money, and out of this also take care of their relatives, I think this will be a very good start. For Kenya, may I give you the statistics, or again give you the statistics again which I gave? We screened about 5,000 school children after training 2 nurses using the German dual system to screen 5,000, and after for rheumatic heart disease, and we could statistically establish 0.2% of rheumatic heart disease in Ghana, which is a very, very low result, meaning that more or less Ghana has virtually no problem with rheumatic heart disease, for you to understand. And also, we trained physicians, not cardiologists, physicians who are qualified physicians, qualified pediatricians, to learn how to use echocardiography device to diagnose heart disease. And we are, within 2 years, we could train 13 physicians for pediatric echocardiography programs, as well as 13 adults, so that we have more or less given such an impact as training program for such situation where such challenges in healthcare is important and demanded. So for these are some of the statistics. We are still doing more. Database. I published in 2014 the result of a capacity building program in Africa by contacting all the heart centers, not all, about 70% of heart centers in Africa, and getting data from them in order to publish such a data. That means you need networking. intra-continental networking, intra-institutional networking to address such a problem, problem, and share with them. Of course, it's not an easy job. We have to know the people. Those I was successful because I know most of the surgeons or most of the institutions. So this is very important to establish partnership programs within the continent, within the countries, within the regions, so that such a program can be easily done. And regarding Cuba, I think I'm very grateful, or we all are very grateful for Cuba's contribution towards, I will call it, health diplomacy programs of Cuba. And nobody actually has any problem or this against that. And we are very, very grateful for such assistance. They have helped a lot in the developing countries as well as also in the South African country. And we hope we still maintain such cooperation with the Cuban government and also with the Cuban colleagues. Thank you very much.
Thank you. Thank you.
Safe travels.
Thank you.
It's good to meet you.
Thank you.
Thank you, Professor. Colleagues, may I invite you to give a round of applause to Professor as he leaves. So we have one more from Ambassador Parut from Chad, please.
Merci beaucoup.
Thank you very much for giving me opportunity. I'll be very brief. I would like to thank and congratulate all the professors and doctors who have taken turns to give us this overview of health cooperation. My question is very short. We've had Ebola in Guinea. We've seen an extraordinary outpour. Many things were done and we managed to defeat that disease, but we now again are facing a health challenge. It's starting to reach alarming proportions, and there are very few indicators that show that if someone is somewhere, in whether it's in the Congo or any other African country, how things will be playing out. So we have that concern. It's serious concerns. There are African students who are trapped. They cannot be brought home by plane. Our countries are not all equipped to deal with such cases. So we don't want to bring in the disease into our countries. So I'm looking to the WHO. We might have to reassure the countries and call each and everyone to take up their responsibilities. At the last minute, we should not dither when the disease breaks out or spreads further. I would like to thank Cuba. When we talk about health diplomacy, I think this is a pure example of cooperation. And this country, Cuba, despite all its constraints it's been facing for years and years, this country has always made a difference in health issues. And I'm very interested to know in WHO, when you talk about South-South cooperation, Cuba is really the champion. We have a lot to learn from Cuba. And it seems like it is a bit overlooked. The contribution of Cuba should not always be overlooked through this health cooperation. I speak on behalf of my country. I myself negotiated with Cuba the training of 140 Chadians who received training. I don't know which other country would offer us such training. And there are Cubans who are present in areas in Chad where Chadians don't even want to go. They're sending their health professionals in many countries in the south, and that is the kind of cooperation that should be highlighted and given visibility. We have lessons to learn from Cuba, but often this is overlooked, and that is really a pity. Thank you.
I Thank you, Chad, for your observation and for those very constructive comments made. Colleagues, I understand that there has been some questions posed, and one of which has just been raised again by Ambassador Barud of Chad. And whilst we have the convenience of our panelists, whom I understand may have some other commitments too, and also noting our agenda that is coming after this, may I now request a feedback, starting from Dr. St. John and then to Dr. Mullenbeck of WHO. Thank you so much.
Thank you, Chair. So the first thing that I would respond to is a comment that was made by the Ambassador of Kenya, and it is this whole idea of how do we change programming and policy given what is found in research. And this whole issue of the gap between research and policy is something that I think that we need to pay some attention to. In CARFA, one of the things that we do is that we have an annual health research conference. The 65th conference is coming up this year in June in Jamaica. And then we, in CARFA, also do a digestion of the research that is delivered and provide a policy portal so that persons can benefit from Caribbean research or research done in the Caribbean. You asked a very good question. What is the compliance with the school nutrition guidelines? And it isn't always good. Let's be honest. When it comes to changing dietary habits, it can be a hit or miss because the public health institutions and the ministries of health don't have a budget for health promotion that can match the advertising budget of some of these fast food purveyors, those who bring in, export foods to our shores that have changed the cultural tastes of our citizens. However, the school nutrition guidelines are part of a constellation of interventions. And one of the interventions is this whole issue of policy. And in the last year, ministers of health have decreed that there would be no sugar-sweetened beverages served in the school environment. And this policy, because it stops the sale, has been quite successful in terms of the compliance in the school setting. There have been other policies about the increase in taxes on sugar-sweetened beverages, and in some countries where research has been done by the academic institutions, there has been a reduction in the use of sugar-sweetened beverages and an increase in the use of water. Unfortunately, that isn't good for the environment because these water bottles are plastic. But anyhow, let's not go to that discussion yet. But there has been an actual increase in the use of water over the use of sugar-sweetened beverages. So yes, there has been some compliance, especially for policy interventions, and there has been a reduction of use of sugar-sweetened beverages actually documented. I also wanted to acknowledge and thank Cuba for the support it has given the Caribbean. One area that I would like to speak about is Operación Milagro, where the cataract burden throughout the Caribbean was specifically addressed by surgeries conducted in Cuba, and there was also a twinning with Venezuela. This was some years ago. And it was a joy to see people saying that they can now see again, they can now read again. And also echoing one of the examples that was given by the Cuban ambassador, the support to vector control programs in the early days. I can remember in the early 2000s, this whole support to vector control. Now, I am assuming that the ambassador from Chad was speaking about COVID-19, the coronavirus. In the region of CARICOM, the heads of government have just met in an intersessional, and they have mandated a regional protocol for the approach to COVID-19. And so CARFA has been working with other sister CARICOM institutions, mainly in the health, in the security arena, but also with the Caribbean Disaster and Emergency Management Agency, because our remit is only for the health sector. So we have been working with them, working first on border control, improving the protocols and the actual measures that have been put in place. We have also started testing. Apart from CARFA, 8 member states have testing capacity for COVID-19. And now we are working on treatment and management protocols. And we are doing this in collaboration with PAHO, which is the WHO Regional Office for the Americas. And we are also working with SEDEMA for the coordination of other sectors outside of health. And this demands that there are certain measures that are put in place in what we call the current preparedness phase, because although we have had many persons coming from China, we have not had any cases of COVID-19 in Caribbean. So right now is the preparedness phase for getting things together. And we are also going to be looking for a certain suite of actions when we have the first importation or importations, and then a further suite of actions for when transmission is established in our part of the world. One of the things that we've been working on is this whole communications, risk communication approach, because there's a lot of rumor mongering, scaremongering, fake news, and it is doing quite a bit of damage in terms of creating panic and also giving the wrong impression about what our member states are doing or what our capacities are. So that is one of the other areas that we have been working on. And it would be good if we could have more of that kind of cooperation on the best practice measures to help us all deal with COVID-19, because he's a very bad boy, COVID is. And so we've got to get our measures in place. Thank you very much, Chair.
Thank you, Dr. St. John, for your feedback and clarifications to the questions raised. May I now invite Dr. Mullenbeeks, please.
Thank you, honorable ambassadors, for the questions. I will try to answer them briefly. And I'm happy to provide more information afterwards or on another session, because I think we can spend the whole afternoon on discussing COVID-19 and the preparation for that. So I will try to be very brief. To the honorable ambassador of Burundi, I would fully agree with your analysis that we need more sustainable, and I put the word sustainable in front of funding for health systems, and that this is really, really critical to get there. We need the right combination, I would say, between political willingness, technical assistance, and financial resources. And your idea to bring this up to the highest level of government is, in our view, absolutely critical. It cannot only be international support, it also has to be domestically funded and sustainable. With regard to your comments around the health workers, we are well aware of it. This is something which WHO has been working on for a long time, and it is definitely very critical in our collaboration on the UHC partnership. Training of healthcare workers, and I hope that with this I can also answer the question of the Honorable Ambassador of Kenya. Training of healthcare workers is critical in our partnership. And this is looking, as Dr. Tedros was mentioned, specifically at the gender issue. As you all know, I think women are the biggest or the largest group of health workers in the world, not only in the ACP countries, but in the world. So they are, as health workforce, as we like to call them, a really critically economic force also. So for us, they're quite important, not to say the important one. And you might know, if not, I'm happy to explain a bit more about it, that Dr. Tedros last year announced or called upon to celebrate in 2020 as the year of midwives and nurses. So we are doing all over the world celebrations and events to really draw the attention of the critical importance of this workforce. And this brings also the element of community care. This is critically important. We have passed in the World Health Assembly last year a resolution that focused really on the integration of community health carers in our work. In our view, the only way on how to move forward to really people-centered care, taking into account the community and the culture of that community. To the Honorable Ambassador of Cuba, I would like to thank you for your intervention and very much acknowledge the support that is given by Cuba and by the Cuban health workforce, especially in critical outbreaks. Just to highlight, this is not something that WHO takes lightly. Only yesterday, Dr. Tedros has had a meeting with the Minister of Foreign Affairs of Cuba, really focusing on this, on the commitment of Cuba and the strong commitment of Cuba to health for all. So it's definitely not something that we take for granted. The support of Cuba and the medical force of Cuba, especially in outbreaks, have been critical. And I want to take this opportunity to mention just one small element. We are currently still in an outbreak of Ebola in the Democratic Republic of the Congo. So it's not over. We're still having an outbreak there, and we're very happy that the numbers are reducing, and we're very pleased with that. But in the whole year, to work on controlling this outbreak, we have been training together with partners, including with Cuban partners. We have been training local staff, local health workforce, to be really the top epidemiologists when it comes to Ebola. There are none better than the ones that have been working on this for more than a year. The question we are facing is, how can we make sure that we don't lose this capacity? And this is, I think, the main question, or one of the main questions also for this meeting. How can we make sure that this capacity that has been built up is not lost? And then finally, to your question, Madam Ambassador, I think that Dr. Sir John had already given some elements, so I will not dwell too long on it. So we have been working quite a lot from WHO initially, and still trying to contain as much as possible the virus, so avoid and provide time to countries to prepare. This is what we have been doing, and this is where we are still focusing on. But that means that we also need to focus on the preparedness. And you're absolutely right. There are a number of countries who are not well prepared enough. WHO has been working in the last months to have an overview of what that is. What are countries that are at high risk and countries that have low capacity to deal with an outbreak like this, and what would they need to support. So this is why we have launched this large appeal, which some of you have heard, and where we are receiving funding and support now. We are upscaling, for example, if I talk about Africa, we are upscaling capacity from 2 countries where we could test COVID-19 to at least 1 laboratory in every country in Africa where that can be tested. So at least that we can test everywhere. And so we're gradually upscaling our capacities, or the capacities of the countries. If I may ask, this is an opportunity to really also look at it and how we can use this to make our health systems more sustainable and to use this capacity to build upon for achieving universal health coverage. I think that would be my last word, Chair. Thank you very much.
I wish to thank you again, Dr. St. John and Dr. Muhlenbergs, on behalf of the Excellencies, ambassadors, and distinguished guests that have continued to stay tuned for the rest of your presentation this afternoon. Secretariat, Excellencies, resource people, and IT, including media, I wish to thank you all for your contributions. I wish to thank especially contributions that were made from Burundi, Kenya, Cuba, and Chad. Thank you so much for your PowerPoint presentations, panelists. Thank you for the interventions and comments and questions from the floor. Gracias, merci beaucoup, asante, many thanks, and tanche. Thank you.
Thank you, Chair.
Distinguished invited guests, colleagues, we are now coming to panel 4 of our debate, ways and means to promote partnerships among ACP countries and partners from the Global South. This fourth and last panel of the symposium deals with the promotion of South-South and triangular partnership between ACP countries and partners from the Global South, and in general with all partners who are interested in South-South and triangular cooperation. This is not such a simple issue. We have to identify areas of cooperation, comparative advantages, the right partners, and find the necessary resources, and that can take time and cause additional costs. The ACP group since 2011 has engaged in promoting South-South and triangular cooperation through various actions. This commitment has led to the creation of the ACP Information Center on South-South and Triangular Cooperation in 2018. This center must be a center of knowledge to facilitate South-South and Triangular Cooperation and play a role as an interface that is dynamic between South-South and Triangular Cooperation. The center will forge partnerships and mobilize resources to achieve its goals. I would like to recall the ACP's thanks to the government of Equatorial Guinea and its president, Obiang, who have accepted to host this center which was inaugurated. This center will start operating this year. We also need to point out that the government of Equatorial Guinea will participate in its operations in a quite significant way, which is a sign of a South-South cooperation in itself. Now, in order to find ways and means to promote partnerships among ACP countries and partners from the global South, I have the honor of welcoming 3 distinct panelists: Her Excellency Gatiri Isar Kumar, Ambassador and Plenipotentiary of the Republic of India in Brussels, who will talk to us about the Development Fund for India and UN partnerships and partnerships with the Malabo Center. On my left, we have Dr. Elsie Laurence Chenune, UNDP resident representative in Equatorial Guinea. She will talk to us about the UNDP's experience in South-South and triangular cooperation and future partnerships with the Malabo Center. And finally, His Excellency Mr. Gonzalo Gutierrez, Ambassador of Peru in Brussels, who will talk to us about Peru's experience in the area of South-South and triangular cooperation and future partnerships with the Malabo Center. Now, that was to set the stage, and with your permission, I would like to give the floor to Her Excellency Ambassador Gayatri Isar Kumar, Ambassador and Plenipotentiary of the Republic of India in Brussels. You have the floor.
Thank you, Chair. Your Excellency, Dr. Patrick Gomes, Secretary General of the ACP Group, His Excellency, Your Excellency, Dr. George Shediek, Director and Special Envoy of the UN Secretary General on South-South Cooperation, Ambassador of Equatorial Guinea, Your Excellency, Mr. Carmelo Mununsa, Madam Elsie Laurence Chenune, UNDP Resident Representative, Equatorial Guinea, Your Excellency, Mr. Gonzalo Gutierrez, Ambassador of Peru, my dear colleagues, fellow envoys to Belgium and the European Union, distinguished guests, ladies and gentlemen, I want to join the others in thanking the esteemed colleagues and experts who've spoken before me. It was extremely interesting. I also applaud the countries, including Cuba and other ACP member states, especially the workforce, including women workers all over the developing countries that have taken the leadership in helping fellow member states or partner countries, disregarding the challenges that they themselves may have faced, just to make sure that they achieve the goals of sharing whatever they can share. I think that's a very great spirit, and I identify with that as a representative of the Government of India. I would start by, first of all, thanking His Excellency, the Secretary General of the ACP and all the members of the ACP group to give me this opportunity. I would like to say that for India, South-South cooperation, particularly capacity building and higher education, these have always been integral to India's foreign policy initiatives and our approach. Our approach has been to share our experience and knowledge with our neighbors and our friends across the globe who are treading similar paths of socio-economic development. The assistance that India offers, the assistance programs and schemes that India enters into, invariably follows a very set guiding principle to ensure that it is truly valued Our partnership and assistance programs must be guided by the requirements and the priorities of our partners. Our effort is always to build on local capacities, their local capacities, and to create their local opportunities, their local abilities. The objective invariably is to liberate the potential of the partner country rather than constrain its future. The concepts should, as far as possible, we believe, they should harness India's digital capabilities to enhance education, health, public services, financial inclusion, to name a few. And wherever India can help to improve agriculture and address the challenges presented by climate change, that is usually a part of the program. We always aim at bringing greater focus to the youth and the aspirations of the younger generation. This is usually somewhere near the top of our list of priorities. So we have been working with countries like the member states of the ACP on a collective effort to keep oceans open and free for the benefit of all nations. And last but not least, a common priority has always been to strive for a representative and a democratic global order. And the results have been encouraging, especially of our educational and technical ties with the global south. Every year, thousands of bright minds from the developing world come to our universities and colleges, and these students go back. They are really a bridge to the common future of India and our partner countries, carrying on a long tradition of capacity building. The Indian, just to name one of the programs, the Indian Technical and Economic Cooperation Program, the ITEC, has been in place for 55 years now, and we train about 10,000 future nation builders every year from over 160 countries. Our government meets all expenses in such cases. We are also introducing an e-ITEC and ITEC executive in response to a requirement felt in these sectors. Triangular cooperation has become another important vehicle to combine the best of North and South for the benefit of the South. India is exploring and in some cases already working with third countries to respond to a high interest in working together in the framework of a tripartite construct. We have also taken triangular cooperation further. With France, India launched, for example, the International Solar Alliance. We started it as an initiative for countries in particular high solar energy potential zones. But now the International Solar Alliance has made its membership universal. We have invited anybody who would like to join, any country that would like to become a member. And to encourage new partners, we have announced a line of credit of $2 billion for solar energy projects. And this is how our development partnership schemes have been innovative to the extent that we can manage it, afford it, and at the same time, these are relevant to the world's larger sustainable development goals. The IBSA UN Fund is another example of institutional funding for least developed countries that ACP members are invited to look at. India's relationship with Africa has been advanced using consultative and responsive mechanisms under the rubric of the India-Africa Forum Summit. The fourth edition of the IAFS will be held in September 2020. Ladies and gentlemen, I would remind you that together, India and Africa together represent two of the world's most dynamic regions of economic growth and a fast pace of development. Many of the world's fastest growing economies today are in Africa, of which the combined GDP of the African continent is $2.4 trillion. By 2030, Africa will represent almost a quarter of the world's workforce and consumers. So with 54 countries, a billion people, a youthful demographic, and an abundance of resources, Africa will count for a lot. And you will carry our planet's hopes and responsibilities. With Africa, India's trade at present is valued at $69 billion. This represents actually a 12% increase over the previous year. We have a duty-free tariff preference, which extends duty-free access to 98.2% of India's total tariff lines, and 38 African countries will benefit from this scheme. India has also become the fifth largest investor in Africa with cumulative investments of 54 billion US dollars. And we are glad that Indian investment has created thousands of jobs and opportunities locally. In terms of our development cooperation, over two-thirds of India's LOCs in the past decade have been offered to African countries. Currently, 189 projects in 42 African countries valued at $11.4 billion are being implemented under Indian LOCs. And these projects, I think it's important to stress that these projects range from drinking water schemes to irrigation to solar electrification, power plants, transmission lines, cement plants, technology parks, and railway infrastructure. So from the small local level to the grander infrastructure level, whatever our partner states have prioritized and whatever is feasible for us. Our cooperation incorporates power projects and dams in Sudan and Rwanda, water treatment in Tanzania, sugar factories in Ethiopia, technology parks in Mozambique and Swaziland. And to bridge the digital divide, a Pan-Africa e-network was launched across Africa in 2009, bringing tele-education and telemedicine to the participating countries. And as I would emphasize, African countries will have a very, very important role in the success of the International Solar Alliance. We are setting up large-scale solar projects of 500 megawatts each in several African countries. We are also working through the International Solar Alliance to build solar water pumping systems in at least 9 African countries. And we are working on establishing solar training, application, and research centers in 6 African countries. So this is the potential. This is just indicative of what we are doing and what we can do, and the potential for cooperation in Africa and in other ACP countries. In the Caribbean, our development partnership has ranged from providing training and capacity building to extending financial assistance, building upon New Delhi's dialogue with the Troika of foreign ministers of the Community of Latin American and Caribbean states. We are exploring the possibilities of forging an India, Latin America, and Caribbean dialogue mechanism similar to the construct of the India-Africa Forum Summit. So our economic engagement with the region over the last 2 decades has mostly been in the areas of IT, pharmaceuticals, energy, automobiles, agribusiness, food processing, and agrochemicals. And we look forward to expanding this cooperation to new areas like renewable energy and even space cooperation. On the renewable side, India has invited each Caribbean partner to join the International Solar Alliance, and we hope to work with you to bring in a new era of clean solar power. And India is ready to share its technology in e-governance, tele-education, and telemedicine, and we have offered to provide weather forecasting and mapping of mineral resources technologies to this region. With the Pacific Island partners, in order to pursue our common vision and developmental goals, our dedicated platform for partnership, that is the Forum for India-Pacific Islands Cooperation, that has been active and we have been seeing encouraging results. Through an annual grant in aid, India is able to help with the funding of key socio-economic development projects in areas of solar energy, disaster mitigation, infrastructure, rural economy, and of course in the social sector. Under this scheme, projects and activities are identified by Pacific Island countries themselves. Again, this is as per their needs and aspirations and their projection of their requirements to our government. In response, ITech training courses, then cultural scholarships, educational scholarships, special training module organized by the Foreign Service Training Institute, that is for diplomacy. These not only contribute to capacity building in Pacific Island countries, but they also provide an opportunity for greater people-to-people interactions, which we value very much. India is also willing to strengthen trade and investments with the Pacific Island countries in mutually beneficial areas like fisheries, agriculture, sugarcane, rice, coconut, coir, oil and natural gas, mining, water desalination, and other areas prioritized by our Pacific Island friends and partners. And we remain continuously in dialogue, looking for the next goals, building on our complementarities for a durable, long-term and mutually beneficial economic partnership. India, like the Pacific Island countries, is experiencing firsthand the negative impact of climate change and the challenge of preserving fragile ecosystems. So here too, sharing of best practices and eco-friendly technologies in renewable energy, in agriculture, in incentivizing afforestation, expanding the use of low carbon and renewable technologies, and improving energy efficiency. These are areas that we have in focus with the Pacific Islands. And our experiences and successes, I'm happy to say, may be useful to other ACP friends facing similar challenges. Ladies and gentlemen, I would only emphasize that India and the ACP member states have a long history of friendship and very serious cooperation. We have learned over the centuries in many cases how to work together, and the friendship and trust that we have built during the last decades since India's independence with the individual member states of the ACP group, they have shown us the tremendous potential of our partnership and joint efforts. I'm confident that we can build on our successes for the real benefit of those sections that really need it. And having seen a powerful South-South solidarity in this grouping of the ACP in Brussels, I had the honor of being invited here on ACP Day last year, and I was only too happy to respond to the kind invitation of His Excellency the Secretary General and the ACP group. We have since then been in dialogue. We have applied ourselves to see how we can institutionalize India and the ACP working together. And in that context, we have been working on a simple memorandum of understanding for cooperation between India and the ACP. The draft that we have been looking at has been agreed to in principle by the Government of India. And I am committed to taking this initiative forward, to making this initiative of Secretary General Patrick Gomes a reality. And I see it as one more forum for consolidating South-South cooperation, and I look forward to its early finalization because this MOU would actually facilitate sharing of knowledge, know-how, and information. It would help to identify potential priority areas for collaboration, always as per your own priorities, utilizing our successful experiences in the areas selected by you. The institution that you would identify to work with us, whether it is here or whether it is in Malibu, those are the details that we will work out as per your convenience. And I am committed to seeing this through in a few days or weeks from now. But I would just simply conclude by saying that that is the work in hand at this moment, Excellency. And once again, I thank you all for this honor to once again be invited to be among you, to participate in this symposium, and to have this opportunity of addressing you. Thank you very much, Excellencies, for these moments of talking to you. Thank you.
Donc, je remercie l'ambassadeur de l'Inde pour cette présentation.
And I just thank the ambassador of India for that detailed presentation relating to the potential cooperation between her country and the ACP countries. She has urged the ACP countries to come on board. You know that there's the Alliance for Solar Energy, which has a substantial budget. We are now negotiating an agreement with India in order to facilitate our trade. Now, we have heard about India. Let's hear now from Dr. Elsie Laurent Chounoun, UNDP Res Rep in Equatorial Guinea. You have the floor, madam. Thank you very much, Your Excellency. Your Excellency, Ambassador of Gambia, Dr. Patrick Gomes from the Secretary General of the ACP, Your Excellency, Ambassador of the Republic of India, Your Excellency, the Ambassador of Peru, His Excellency, Mr. Jorge Shediek, Special Envoy of the United Nations Secretary General for South-South Cooperation, distinguished guests. Let me also state that Madam Maricruz Andime, who is the Director General of the Foreign Ministers Association in Malabo, Equatorial Guinea, as well as the first Secretary of the Equatorial Guinea Embassy here in Brussels, Mr. Veste, or you know, they are here, and I think it's an important thing because they represent the country in which the Center for South-South Cooperation is headquartered. Let me thank Dr. Gomes for his invitation to participate in this discussion, which is a very important one. When I learned that the Center for South-South Cooperation was going to be based in Malabo, I thought it important for the UNDP to be involved in the project. So I wrote to Dr. Gomes in order to see how UNDP can cooperate with the ACP in order to ensure the center be a success for all ACP countries. He did not hesitate. He invited me. I couldn't say no because we are on this we are from the same region of the globe. He's from Ghana. I'm from Haiti. So I am happy to be here in order to share UNDP's experience as regards Equatorial Guinea and the potential we have in cooperating along the lines of South-South cooperation. Let me also acknowledge the political commitment of the President of Equatorial Guinea. Equatorial Guinea hosts the center, and as the Ambassador of Cameroon said at the start, the president showed the political will where he not only gave the premises, but he will ensure the center functions over the next few years in terms of financing. It's an example which other heads of state or other political decision makers can follow in order to ensure that cooperation is a success. Let me go on to my presentation in English because it was drafted in English.
La coopération sud-sud, qu'est-ce que c'est?
Well,
as you know, there are 17 SDGs, the 17th being the partnership. And we are very strong in partnership, UNDP, and whether we are in Equatorial Guinea or in other countries, partnership is key for us to be able to succeed in the goal. And partnering with ACP, particularly in the South-South Center in Malabo, is very important for us if we were to ensure that collaboration, that South-South, that the SDGs themselves are implemented successfully. Now, just to start a bit, I would like to just give a brief synopsis on our work. We operate on a 5-year cycle. In Equatorial Guinea, our country program document started in 2019 and is supposed to end in 2023. It has 2 pillars, and they are aligned to about 10 SDGs, as you can see. When we are formulating our program, we make sure that they are aligned to the SDGs, and then by implementing our program, we are also implementing the SDG at the same time. So the first pillar has to do with inclusive and sustainable development, aligning with already 9 SDGs, and the second pillar has to do with strengthening effective, accountable, and inclusive governance. And to the right, you'll see some of the areas of intervention over the 5 years that we're going to be working on specifically in Equatorial Guinea. It has to do with statistical capacity building. That's important for the countries in monitoring the goals and reporting on the goals. We know that a lot of countries don't have the statistical capacity, or they have the data but they don't know how to report on the data. So for us, it's key that we build the capacity of all the countries in data, in statistical analysis. Job creation. We are in all 3 regions, whether it's Africa, Caribbean, and Pacific, there is issue of unemployment in all 3. Africa in particular has the highest level of unemployment. So it's important that as we seek into implementing the SDGs, we look at job creation. Access to labor market is a key. If we were to create job creation, we have to ensure that countries have access to labor market. Youth is an extremely important population that we're working with. Youth is our future. We have to take care of our young people. We have to be able to educate them, to give them the means to be able to succeed. So our program is really targeting young people wherever we are, whether it's in Equatorial Guinea or in other countries. Social protection is another aspect. We had presentations before on health, the health sector, for example. We know in our countries, social protection is an area that sometimes is ignored for people to be able to have really access to basic services. HIV/AIDS. Equatorial Guinea is unfortunately one of the countries with a very high prevalence right now of HIV/AIDS, close to 7%. We're working with the government, and we have to recognize also the commitment of the government in providing medication to the people free of charge, to the people who are affected by this. So this is an area where we are collaborating with the government on that. We're working on the protected areas, looking at the impact on climate change, for example, ensuring that their biodiversity and the environment is preserved. Sustainable energy, that's extremely important if we are to mitigate the effect of climate change. Human rights is another support we're giving to Equatorial Guinea. Access to justice. Another key population is women that we are working with, because we, just like the young people, we need the women to be empowered, to be able to do their work properly. So the women population have always been left behind in the past. So we still are not there yet. So our program is very targeting women, just as it's targeting the young people. The ITC, technology, and economic diversification. For Equatorial Guinea, this is important because it's used to be a country that's very dependent on oil. And with the drop in oil prices, it was important for them to look at how to diversify their economy so that they're no longer dependent on petrol. So this is an area where they're working with the signing of the IMF agreement, the program that they signed in December. That is an aspect where they need support, and we're working with them on that. So based on those 5-year country program document, our main activities for 2019-2020 are in these areas, targeting about 9 9 SDGs. So the first one is on HIV/AIDS, in particular trying to see how we can help in sensitizing the people to reduce the prevalence rate and to also ensuring that medication is well distributed to those who are affected. In energy, sustainable energy for all, energy efficiency, and to be able to make sure that we use as much as solar panels and hydroelectric as possible, so that we don't use the oil that we used to do, given the fact they have already, the country is too much oil-based for now. And the third one is on human rights, promotion and respect of human rights, as well as support for development trade in the country. This year, we are focusing a lot on the youth. To the right, you'll see that we are trying to have to establish a national youth institute within the Ministry of Youth, to be able to support the young people. They know exactly what their rights are, how they can go to get access to the labor, to get access to education. So this institute will be important in empowering the young people. We're trying to also get them to connect with other young people in the region, not only in Africa, but also in the entire world, so that they are able to have access to other best practices and to other opportunities outside. We are working with the government also in designing a Wi-Fi project where in the schools in particular, where they'll be able to access Wi-Fi, free Wi-Fi for all of the schools in the entire country. So this being said, this is where I would say UNDP comparative advantages in the matter of South-South cooperation is. You may have heard the Secretary General of the UN say that UNDP has an integrator role in the SDGs. That means that what? UNDP is, when we work in a country with other UN agencies, we have to ensure that whatever program is formulated, it has to integrate the SDGs. Just like we formulate our country program document to be aligned with the SDGs, we have to make sure that the SDGs are integrated in the response we give to governments and to other partners. So doing so will include also South-South. We need a South-South aspect, because to us it's the good modality to be able to implement the programs. We have about 100, more than 100 of our country offices actually have one way or another collaborated in South-South initiatives. We had, in 2018, we had about more than 900 South-South initiatives. So we have extremely large experience globally in South-South. And I know that Jorge will agree with me, and I'm actually talking under his control, that we are actually probably one of the best placed in terms of promoting South-South in the entire world. The other strength we have is we have been working a lot on what we call country support platforms and country accelerator labs. These are going to help us integrate, do the integrator work that we are set to do. Because the country support platform, what it does, it allows a lot of sectors of the society to come together and think, whether it's civil society, whether it's private sector, whether it's UN agencies, whether it's the government. The support platform come together around one problem to find solutions to that problem. And this is extremely important in terms of South-South, because it will facilitate South-South cooperation. The Accelerator Lab is very new. It has been impulsed by our new administrator. This is where we believe innovation is also key. And this is where we give the voices to the young people to innovate on a solution. They just come and it's incredible what you can see the young people are doing right now all across. They are coming with things that I could never think they would come. In a month, they are able to come up with solutions. So this is where the young people can collaborate. Coming together, whether they are in Malabo, or they're in Peru, or whether they are in Brazil, or in wherever they are, they can collaborate on these labs. Because the young people now, how they are. I mean, they're just an iPhone or any phone. They can do anything with any phone, with any Wi-Fi, any internet. So it's really heartwarming to see how these accelerator labs can help and can generate the innovation, right, for the youth. Now, going to the offers specifically, what are the offers that we have? I can say there are two areas, on the enabling environment and also in terms of network and exchange platform. In terms of the enabling environment, where we know we can have some offer for the South-South cooperation, for the ACP Malabo Center, is to facilitate engagement. We can facilitate, because being present in over 170 countries in the world, we can facilitate engagement of all these countries. I can just call my colleague in Qatar, and she or he will be able to tell me, to give me something. If a country doesn't have something specific, or I'm not able to offer something specific, I can call another country or a service center who can tell me, okay, we've done this, this is it. So we don't have to reinvent the wheel. And that facilitates engagement. We also are able to strengthen institutional capacity. That's one of the strength of UNDP, working with governments like parliaments or senates or others. We are able to work with them in terms of to strengthen their capacity. Strengthen also the M&E mechanism, which is important, particularly for the SDGs, to monitor and report on the SDGs, and South-South cooperation also to facilitate bilateral and intra- and interregional South-South initiatives, given our global presence, as well as capacity development of all sectors, whether it's academia, whether it's civil society, think tank organizations, governments. So this is an area in which we are extremely strong. The second offer, I said, was in the network and exchange platform, because for us now to be able, for people to be able to meet and to exchange, it's important that we leverage what we have, our platform, the platform that we have all over the world. I don't have to go physically to any country right now to be able to access to know what they're doing. So these platforms that we have enabled in all of our countries will be able to support the South-South cooperation as well. So in terms of this, for example, we can facilitate local solutions that can work in different contexts, that can also improve knowledge. The country support platforms also provide a space for South-South exchange, access and exchange solutions and good practices, and most of all, bring together the demand and supplies side of the development solutions. Now, particularly on the ACP, you would have learned today that there was an MOU that was signed with UNDP in 2016, in which, and I believe Dr. Gomez was the one who signed the agreement with our administrator in 2016, where they have agreed to cooperate in a lot of sectors, including inclusive and sustainable economic growth, in the area of renewable energy, in disaster risk reduction, and particularly, I would like to stress the DRR and the climate change adaptation, because a lot of countries in the ACP are SIDS countries. They are small island developing states. I used to work in Jamaica before I came here, and I know that I can say every year there was a disaster somehow, somewhere in the region. And we had 4 months where we had to be ready for anything, from November 1st. Is it November 1st? I forgot now. Anyway, we had 4 months where disaster could strike anytime, so we had to be able to do that. These are countries that are very vulnerable to the impact of climate change, extremely vulnerable. So working in that area, whether through South-South cooperation or triangular cooperation, is extremely important. And this is an area where we had cooperated a lot with the ACP in the past and now to build a capacity for disaster risk reduction. I mentioned the small island developing states, the South-South and triangular cooperation as well among member states. We had also worked in the area of social protection I mentioned before that we have in Equatorial Guinea. The Malabo Center was launched in October 2018, and I'm saying that maybe Mrs. Maridona, they would say in Equatorial Guinea. Maricruz can confirm that. It was launched on the 5th of October in 2018, and it was signed on 9th of August 2019. And there's an agreement, I believe, that was also formulated for the ACP Information Center for South-Southern Triangular Cooperation. And the three scope of work are in disseminating information regarding SSC and TRCs, creating online platform to exchange information, and serve as an interface with the ACP Secretariat in Brussels. So these are the main scope of work, but I believe at one point or another, the ACP will look at exactly what it means in terms of the activities, the action plan that they're going to develop. And we are, of course, UNDP is happy to help in that as well, in looking at the sector. And this is the scope of possible cooperation I can see with UNDP Equatorial Guinea. We are present, we are on the ground, so we are not leaving, we're there to stay. I may leave, but I will have somebody else who's going to come. So we have access to other countries. We have access to expertise. We have the private sector, not sector private sector development. For example, that's another I think one of the area of cooperation between UNDP and the ACP, the center. The ambassador of India mentioned the work that India has done. A lot. They just opened an embassy in Equatorial Guinea a few months back, and I've been in touch also discussing with the ambassador of India there to see how we can cooperate. Already I was thinking ahead of the center, how we can cooperate on that. He's waiting for me to come back and see, and discuss more about that. Capacity building of civil society organization. We know that the CSOs are extremely important in reaching out to local communities in our countries, but yet a lot of them don't have the capacity to do so. And I think building their capacity, their strength to be able to respond better is extremely important if we are able to really implement programs that will make sense and that will allow the countries to meet their SDGs. Promotion of use of renewable energy, I believe, with that whole issue of climate change, the SIDS, this is an area that we are strong in and that we can support. Promotion of decent work and economic growth, particularly for the young people who are our future again. The Youth Connect, which is a platform that connects youth throughout Africa and the entire world. That's something that we are going to launch this year in Equatorial Guinea with the government, the Youth Connect, to give voices, stronger voices to the young people and to allow them to have accesses to others. We know that there's a startup European award. So, and there's a possibility of a startup ACP award that I've read somewhere. That's something that maybe we can think about and see how we can promote entrepreneurship in looking at that kind of award. Social protection, and of course the online platform of information exchanges. We already have one, the SSMart, that's being used in other countries. So this could be of help also in moving forward with the cooperation. So with that, I would like to thank you very much for giving me the opportunity to present, and I'm available if you need more information. Thank you.
Thank you very much for that very comprehensive presentation, and the fact that the UNDP had signed an agreement with the ACP can only facilitate the work with the Malabo Center. Now, to conclude, I would like to give the floor to His Excellency, Mr. Gonzalo Gutierrez, Ambassador of Peru in Brussels, who will share Peru's experience in the area of South-South and Triangular cooperation and potential cooperation with the Malabo Center. Thank you very much, Ambassador.
Daniel Evinave, Ambassador of Cameroon. Your Excellency, Patrick Gomez, dear Secretary General of the ACP countries. Your Excellency, Jorge Chediek, the Special Envoy of the Secretary General for South-South Cooperation, a dear friend, and a former representative of the UNDP in my country, where he did a great job. Dr. Elsie Lawrence Chounune, our representative of the UNDP in Equatorial Guinea, and my dear colleague, the Ambassador Gayatri Sarkumar, Ambassador of India here in Brussels. I have a very long document, which it will be absolutely boring for you at this very moment, so I will try to summarize some sections, and later the Secretary General will take charge of distribute this document in order for you not to get sleep now. And we are running late. I just want to say that for us, for Peru, Peru is a country that is a recipient and a donor of cooperation. So we are in a very particular situation. But the relationship with the ACP for us is quite important because it's also an excellent vehicle to promote our relationship with Africa, the Caribbean states, and the Pacific. Africa, for instance, it's 54 countries and 48 of you are members of ACP. And for Peru, the relationship with Africa is quite important because you are the future. You are the future. I was just watching some figures, and the IMF plans for this year, 2020, that the Africa and the ICP will be the second fastest region growth in the world, with 3.6 as a regional growth. And that's an increase from 3.2 that was last year, 2019. For us, we are not able to be present in all your countries as we wish, but the relationship with ACP Secretariat and the ACP Center would be an excellent way to increase our presence in Africa. Peru has strengthened in the last 10 years its cooperation as a recipient and as donor. The work that the Ministry of Foreign Affairs, where the National Agency for Cooperation is based, it's centered around 4 key elements: our potentiality, our planification of targets, the sustainability of the work, and the issue of development. As I said before, during the 10 last years, we have increased our participation and the participation of our public and private sector as well in complementing North-South cooperation modalities. South-South cooperation and as well as triangular cooperation. Peru's South-South cooperation exercises started, as I said, in 2010, and since then our country has progressively increased its participation as an international technical cooperation provider. In 2010, we had 8 projects as provider, and now in 2020 we are in 56 different projects of cooperation to different countries around the world. So this is a proof of our willingness to be more active, more present in South-South cooperation. We share, of course, the principles of the Buenos Aires Plan of Action of 1978 and the Nairobi Conference of 2009 final document. South-South cooperation for us have become a strategic role for our integration process, as well as an important area in cooperation and multilateral development. We are willing to make more concrete this effort of cooperation with the signing of a memorandum of understanding, which has been already negotiated. I think we just need a small legal details and to sign this MOU with the ACP Group Secretariat. This is aimed to carry our mutual technical assistance activities with member countries of ACP, as well as promoting South-South and triangular cooperation. This is part of our concern of Peru in interest areas and priorities that are given by the ACP countries. This instrument, as I said before, would, Peru calling. This instrument will constitute a substantive contribution to the development of cooperation between Peru and the ACP countries. Let me see. What we have been doing up to now. We have been participating in 94 different projects of cooperation, 58 as recipient and 34 as offer country in 2018. And in 2019, we participated in 73 projects, of which 41 were in our capacity as donor or provider of cooperation. And as I said before, in 2020, we have 85 projects. 56 of them are as donor of cooperation. Mostly, our cooperation is based on the Caribbean. We are giving cooperation to 5 Hispanic countries in the Caribbean and 13 English-speaking countries in that area. I would like to stress 2 or 3 of these projects. The joint committees of technical cooperation with St. Lucia and Belize, which are being planned for the first time under the bilateral cooperation programs that will be covering the period between this year, 2020, and 2022. As well, we have a South-South cooperation program with Antigua and Barbuda, Bahamas, Barbados, Belize, Dominica, Grenada, Guyana, Haiti, Jamaica, St. Kitts and Nevis, St. Lucia, St. Vincent and the Grenadines, Suriname, and Trinidad and Tobago. This is the ACP countries which obviously are closer to our country in geographical terms. There are 2 areas where our expertise is more relevant. The first one is prevention and management in terms of natural disasters. We are a country which is very prone to national disasters. We have created a civil defense program which is very efficient, and we would like to share that with countries in the Caribbean that are also very much prone, especially now with the current situation of climate change, which is affecting many of the small island countries. The second area where we are providing training is in tourism and gastronomy, as well as management in fisheries and the certification of hydrobiological products. This is programs that are already working in Peru for the Caribbean countries. But also, we need to take into consideration funding. For all these projects, it's important to develop sources of funding. And we need to strengthen the global architecture for development through an appropriate channeling of financial resources available in the international financial system, which may support the sustainable development goals. We have worked in the past with countries like Germany, Spain, in order to develop triangular cooperation. This is a very small resume of what we are planning to do. What it's our priority here in Brussels now is to finish the agreement with the Secretariat of the ACP, and on that basis provide you with the possibilities that Peru may have to offer cooperation in the areas where we have some capacity, in order to create new links, as I said before, with the whole of the ACP countries, and particularly it's very relevant for us with Africa. This, as I said, is a very quick summary of the paper that will be given to you by the Secretary General. Thank you very much.
Merci.
Thank you very much, Excellency. That was a very comprehensive presentation. And as you rightly said, now we have to finalize this MOU that will enable your country to better work with the ACP countries and share your expertise in various areas, as you've mentioned, prevention, disaster management and prevention, tourism, and so forth. Now, colleagues, these are practical examples of what is happening on the ground. And these are our partners who work with, and we also have the center in Malabo. I don't know how much time we have. We have a half an hour, I'm told. That gives us ample time to take questions. I would like to open the floor now. Please introduce yourself briefly before you ask your questions.
Yes. Is that better? Yes. So, again, apologies. And also, my points may have been covered in the afternoon earlier, but you will tell me. So my points are general points. First of all is I would like to promote the idea that there needs to be a greater awareness of the contribution and role of science to the attainment of the SDGs. I think this is something I'm really passionate about, and I think that can't be done too much. The second point related to that is there needs also to be a greater recognition of the need of science mechanisms to deliver the SDGs at global level. And by science mechanisms, I am essentially talking about science data infrastructures. And of course, during today, there's been much reference to innovation and different areas of science, which is wonderful. But I think we're looking towards a world of unitary science, where science, research and development is data enabled. And therefore, within that, there needs to be arguably a single capacity to deliver and enable the conduct of science. So I'll just leave that as a headline point. Now, if one accepts that data will drive innovation, I think there's a perhaps an unrecognized, hugely important point related to broadly innovation and the attainment of the SDGs, and that is the issue of data protection. You will be very familiar with the European Union's General Data Protection Regulation, which came into force almost 2 years ago, and you'll know what that does. But my point, and the point I want to emphasize here, is the impact this will have on the conduct of collaborative research and development between and amongst nations, between developed nations, less developed nations, between and amongst developed nations, between and amongst developing and less developed nations. And therefore, I would really like to advocate for the establishment of a process that addresses this absolutely, I would argue, critical theme. I've heard here references to the health-related SDGs, to the importance of delivering healthcare and attaining therapies and managing the delivery of these at local ground level. I also point to the need for localized clinical trials, and broadly my point is, in future, that if less developed nations are unable to share data, to enable machine learning, to evolve artificial intelligence, arguably we could have what I would argue is a colonial situation where lesser developed nations are reliant on developed nations to do the science, to evolve the innovations, and to develop artificial intelligence. So my point is, there should be a process undertaken to understand how that can be enabled, how developing nations and less developed nations can be enabled to do it for themselves, to generate the capacity, to generate the knowledge and know-how, both based on access to local samples, and of course then to evolve and own the innovations emanating from this. And more broadly then, just to enable the collaboration and participation by nations around the entire globe to participate and collaborate on equal terms in evolving the attainment of the SDGs, as I said, particularly in the area of health. But I was also intrigued by the ambassador from Peru's reference to astronomy. And I have two reasons for saying that. One is just a point of fact, is that Southern Africa was chosen, along with Australia, to build the Square Kilometre Array telescope. And you may know that the Economist newspaper referred to this project as the world's largest science project taking place in Africa and Australia. But my point of raising this is that if you ask where IBM and Cisco and Oracle are developing their computational modeling for health sciences, they will tell you it's in Cape Town on the SKA. So just a case in point, and the point there is the relationship between astronomy and health. Not a lot of people know that, but I think it's important to point out, and it just illustrates my fundamental earlier point on the unitary nature of science. In future, it's not going to be about him doing astronomy and she doing nanopharmaceuticals and he doing climate. It will all be data enabled. So then what does that, what I'm calling instrument, look like? My final point would then be just to instance some interesting contexts which I feel are again not sufficiently understood. Much reference again today to the pursuit of innovation. Do the participants here today know that approximately 5 million patents go offline, go off patent every year? Yeah. So 5 million patents are available for use. Problem is, they're not used. Why they're not used? Very few people realize it. And of course, it is a challenge to make that knowledge understandable, accessible, disseminated. That is a challenge. I'm not saying it's simple to do, but I am pointing to the simple fact that there are 5 million patents available. And my question is, wouldn't that be a major contribution to broadly development and innovation for development? In the same vein, I would like to highlight the existence of the WTO's Article 66.2, which provides a legal basis and onus for developed nations to share technology with less developed nations. And this is on the statute books. It exists today, but again, I see it very little used. And that could be a hugely, hugely important instrument, along with the patent situation, to enable the innovations that are needed, of course, within the context of the SDGs, but of course then with enabling capacity at local, national level, and supporting human capital development, the transfer of knowledge and know-how where it should be transferred, and again, building this resource that the world needs to address the SDGs. That's all I have to say. Thank you, Mr. Chairman.
Alors, je vois la Guinée équatoriale.
I see Equatorial Guinea and Kenya. Equatorial Guinea first.
the presenters for having such a detailed presentation of the work that they do in their respective places of work, but also commend Dr. Chunun for being very candid when she laid out the extraordinary work that UNDP does in Equatorial Guinea. She knows, I know we have a long way to go, and she knows and I know that the UNDP is there to stay. Even if she leaves, as she says, someone will come and replace her and continue with the good work of the UNDP in Equatorial Guinea. I also wanted to probably just shed some light to the audience here today about my country. A little bit like the message from Cuba said earlier on, Equatorial Guinea has the obligation to give back to humanity. My country gained independence in 1968. And up to 1995, when we discovered oil, we practically live on handouts, day-to-day handouts, from the Cameroonian government that would give us sometimes their plane when we couldn't fly to a conference in New York somewhere, to the Turkish government that gave us a lot of assistance in health and education. Cuba is another example, and many others. So when we found ourselves with extraordinary amount of wealth, we thought, well, we have to give back to humanity. And in that sense, we have a little bit in common with Cuba, that although they have a lot of expertise, they're giving back because they feel that obligation to give back. And we give back what we think we have most of. Because of course expertise and technical assistance may not be necessarily where our forte is, but we try to help as much as we can to those that helped us back in the day and those that we know need that assistance today. Equatorial Guinea government signed last year the prolongation of its commitment with the Secretariat pharmaceutical company and American companies to develop the Secretariat PFSPZ vaccine, which includes the third phase of clinical trials this year. This partnership is a clear example of what a successful association could be between an African or ACP nation with the private sector, because of course it involves an ACP country. And so, of course, our goal is to develop a vaccine. We all know that there are many projects of the same sort around the world, people trying to look for this miraculous vaccine that will help us all with the dangerous disease of malaria that affects many parts and regions of the ACP group. So Equatorial Guinea, of course, as I said before, may not have the expertise that others, maybe in Senegal, Nigeria. I studied in Nigeria, by the way. But we give out what we can and we help wherever we can. Our colleague from the Intelligence and Science just mentioned a minute ago how important science is to health and science is to SDG. Equatorial Guinea is also financing a UNESCO prize on research for life in sciences. This is very, very important. It goes to any country, any scientist around the world with no discrimination. The panel of judges is of course run by the UNESCO organization. So you see, we try to help somehow in very altruistic, if I may say, initiatives to help those that may need more of this help. And I think the ACP Center in Malabo, with all this information and more that they can get, they can help us channel it even better, make other ACP nations benefit or contribute to these huge initiatives by they are carried on by I would say a fairly small nation in Africa. We're almost 50 years of age, but with the great vision that the ACP has as well and its members to create and to propel the ACP that we all want, based on multilateralism, based on solidarity. And I know many people have been asking the questions, why is this country giving so much? And well, this is the reason why. And I thought I wanted to explain that here today. That's because we feel the obligation. We have been given so much that we think it's time that we give back to those that helped us and those that we know need our help. Thank you very much.
Merci. Guinée Équatoriale, Monsieur l'ambassadeur.
Thank you, Ambassador of Kenya.
Thank you, Mr. Chairman. I want to thank the speakers for their great presentations, some of them very provocative, but that's the nature of such a meeting. Your Excellency. Having said that, I sincerely want to congratulate Her Excellency Gaitiri Kumar, the Ambassador of the Republic of India, for a very good presentation. Mr. Chairman, to me, India typifies, if you will, South-South cooperation. My own country has been a beneficiary of education scholarships for many years. I'm talking about Kenya, including myself. I did my master's degree in India. And I've said it is typifies South-South cooperation because, Mr. Chairman, we have heard about this baby, ACP India MOU, which is about to be born. Fantastic. That's the direction we should take. And my appeal to ACP countries, it is to follow that route. In the East African region, Mr. Chairman, we have something called Northern Corridor Integration Project, which involves about 5 to 6 countries in the region, including countries like Burundi, Rwanda, Kenya, Tanzania, yes, Somalia and all that. Ethiopia is coming on board. And again, here we request those countries which have centers of excellence to provide scholarships to the members of that organization. And I hope we can maintain that. It will be wonderful. The other thing I just wanted to comment on is Elsie Chune, yes, I hope I pronounced it correctly, from UNDP. She talked about the need to have access to labor market, which is brilliant. But this challenge I've seen over the years is reciprocal recognition of qualifications from different countries so as to make this easy. I want her to share with us the challenge they have encountered in this initiative, because it's a good initiative. Again, I want to ask her, I remember in recent years, and we are talking about the span of about 10 years, there has been a clamor of establishing science parks and innovation centers in our education institutions. It was like a wave. Is there a possibility of using your country accelerator lab approach, which you are saying is in the pipeline, to assist, revive some of these initiatives? Mr. Gonzala from Peru, the distinguished ambassador of Peru, again, listening to you, again, you have said there is going to be Peru ACP MOU. It seems there is a wave, there is a storm blowing here of South-South cooperation. Again, let's keep it up. And I want to thank ACP Secretariat for this wonderful job. And the outgoing Great Secretary General Gooms, can we clap for him? Let's clap for him. Done a good job. And as I really conclude, listening again to what is happening here, the first speaker talked about us having millions of patents which go off every year. What I would want to advise is that we need to share that information in the light so that we can apply it. And if we are not accessing, as he is saying, where is the problem? It is incumbent upon us to come up with solutions so that we can access these patents which you have been complaining they are not accessible to us. I submit, Mr. Chairman. Thank you.
Je ne vois plus de questions.
Well, no further questions. May I ask the various panelists to react to the remarks and particularly try and answer the questions asked. And once the replies are given, each panelist will use the opportunity to make his or her closing remarks. I begin with the ladies, the Ambassador of India. You have been asked a few questions, and then my colleague from Peru, and then the UNDP.
Okay. No, you have a floor, Ambassador.
Thank you, Mr. Chair. I really thank the remarks from the floor, especially from Ambassador of Kenya, my distinguished colleague, for his gracious remarks towards India. And just to reiterate that I look forward very much to working ever more closely with the ACP members and the ACP leadership. There was no specific question for me or for my presentation, so I'll give the floor to the other speakers. And I'm always available at the Embassy of India for anybody who would like to come forward or send me a message or ask me to, clarify something or provide information through the ACP Secretariat or directly. Always welcome, Excellencies.
Thank you. Dr. Shunun.
Thank you very much for the interventions. And thank you, first of all, to Marie Cruz for her trust. And I also would like to say something about that the fact that Equatorial Guinea is a country that's been giving because they have received. And I noticed that offhand, when you don't live in a country, you don't know exactly the country's reality. And for the 7 or 8 months I've been living there, I can say a bit more about the country's reality. That it may be a bit ignored or not understood well, but it's a country that's thriving to survive also in terms of getting over their economic challenges right now and needs support also from others in terms of technical capacity building and others, but very much open to also sharing with others. So, and the fact that the Malabo, the ACP South-South Center is there can also be a way to impulse this, a way to strengthen this kind of collaboration and to get other countries to come more and discuss and be in the sharing stage with Equatorial Guinea. In terms of the questions on the science part, I do believe, and I agree with you, that science is a critical factor in implementing the SDGs, and we recognize that at UNDP, and this is why we are pushing a lot on innovation, whether it's to our innovation labs. We are pushing for that, and we do have a unit in headquarters which looks at R&D, research and development, and science. I will not be able to give you more details about it because I don't know a lot about it, but I know that we recognize the role of science in the SDGs, and we do try to include it as much as we can in the work that we do, specifically with the young people. So, but I am willing to discuss a bit more with you after that, so I could give you more information on what UNDP does. And that's leading me to the question from Kenya as well. Yes, we recognize that it's important. Access to labor market is important. I think the challenges that I've seen is the lack of training. I believe already from the people, because for them to have access to the labor market, they have to be trained well. They have to be able to have some skills, some vocational skills. And this is an area where we're working also with Equatorial Guinea. Equatorial Guinea has been open a lot in the sense that a lot of these sectors, the labor market is being accessed by neighboring countries in West Africa, for example, electricians, plumbers, whatever. So the idea is to try to open up, to train more Equatorial Guineans to have access to this labor market, to have the skills that are needed to access this labor, not only within Equatorial Guinea, but also outside of it. And this is what we're doing as well in terms of South-South, to be able to access. By being trained, you're able to go to travel and access the labor market anywhere. So the training is an important part of it, but that also includes that we have to look at the laws and the policies as well. We have to reform the policies in countries and outside countries, including regional policies, looking at free trade agreements and stuff like that. So we have to facilitate this as well so that people are able to access labor market, whether in their countries or outside of their countries. And for the innovation centers, I think the Country Accelerator Lab goes way beyond the innovation centers in a university, because the lab is for the entire country, not just within a university. So right now there are about 80 accelerator labs, and the administrator would like to have more to have in all the countries. And it's just a pilot phase. So what's going to be doing, they're going to try to scale it up after that based on the success of it. And this is where science also is going to play a big role, because these are accelerator labs that don't come with any terms of reference. They're just open to young people's ideas, to young people's just deciding to look at a solution for a problem. So these accelerator labs will go a long way in promoting science for the SDGs, but also in ensuring that young people across the globe can test their ideas and can innovate as much as they can to implement the SDGs.
Merci, je donne la parole.
Thank you. I now give the floor to the Ambassador of Peru.
Monsieur l'Ambassadeur.
Thank you, Ambassador.
Be fair, and I mention this with a caveat, because this is a commercial with Peruvian interests, okay? I said it before. I think it's very interesting, this idea of patents, to share the possibility of patents. But what can we do about this? One idea would be to use WIPO, the World Intellectual Property Office in Geneva, to be a channel for exchanging patents that exist. Even WIPO, it's a tool for registration of patents already now. So maybe in the future could become an instrument, a tool for acquiring the patents that are now in general possibility of distribution. And this is part of the program that the Peruvian candidate to be Director General of WIPO is mentioning. He's talking about 3 or 4 subjects that are very relevant in the organization. First, to increase cooperation with developing countries, to give priority to small and medium-sized enterprise, and to strengthen the possibility of WIPO to participate in protecting genetical resources and traditional knowledge, which is a sort of a patrimony of our countries. I think now it's time for a developing country like Peru to be heading WIPO. I think it would be a good idea to develop this organization as a sort of clearinghouse for patents that already are in public knowledge. So, if you want that, vote for the Peruvian candidate.
Donc nous arrivons
Well, we've reached the end of this fourth and last panel. I'd like to thank the presenters. I think we can express satisfaction at what has been said. There is a lot of hope, particularly as regards the 2 agreements to link 2 major countries already committed to South-South cooperation, India and Peru, who will be signing a memorandum of understanding with the ACP. UNDP already has an agreement with the ACP. So we hope that those two agreements will bear fruit and will help the ACP Center for South-South Cooperation in Malabo in fulfilling its mandate. Now, reference was made to patents, patents which fall into common property. I didn't know that. Maybe one of the objectives of the center can be to submit this issue to various ACP countries. So I'll stop here and ask all those colleagues who participated in this discussion with a view to enriching it. And I now give the floor to the organizers for the closing words.
Distinguished ladies and gentlemen, thank you for staying till the very end. As we say in English, all good things come to an end. And you would agree with me that it has been indeed a very, very productive day. And we have all learned a lot and benefited from some very, very useful interventions here today, since this morning. I would not take up too much of your time. We're already running very late. In the closing session, we'll have a sort of a closing remarks from Mr. Shediek, who's the UN Secretary General's Special Representative on South-South Cooperation, who is one of the co-organizers of this particular workshop. And then I'll give the floor to the Secretary General of the ACP to also deliver some closing remarks. Mr. Shediek, you have the floor.
Thank you, Madam Chairwoman. I am extremely pleased with this event today. The four panels showed first that South-South cooperation is a reality. As we said at the beginning, it came from being a dream of some leaders from the Global South to become a key element for the fight all the nations in the developing world are facing to build a better future for themselves and for their own peoples. Secondly, that South-South cooperation takes many different shapes and modalities. It is done through technical cooperation, through financial assistance, through sharing of practical experiences, through the training of people, through education grants, as the ambassador of Kenya was telling us about his master's in India. Also, it covers many different issues. Apparently, there are no issues that are not susceptible to being the subject of South-South cooperation. One of those that was one of the most critical during the negotiation of the SDGs, the issue of governance, peace and development, here was shown that is really an area where many countries of the South and many countries of the ACP are really collaborating very intensely on the premise that societies that are not peaceful and stable cannot confront appropriately their developmental challenges. Also health. And now that we are confronting as a humanity a global health challenge with the COVID-19, it is very important that we confirm that health is has a global dimension, not just the national ones that we can address with the local context. And the idea of bringing new partners and expanding partners. And it was really great to see again after many years Ambassador Gutierrez. When I was a resident coordinator of Peru, we had the honor of supporting the Peruvian Cooperation Agency in their first initiatives doing South-South cooperation with third countries, and now you have become a major actor. And also Peru, as recipient of South-South cooperation, developing the conditional cash transfers programs modeled on the Brazilian and Mexican models that created the Programa Juntos, that is considered one of the best in the world in terms of conditional cash transfers, and it was also the result of South-South cooperation perfected by Peruvian leaders. Also India. Ambassador, you mentioned a lot of things, but really the leadership that India is showing is remarkable. Leadership, as you mentioned, doing concrete things. We are very proud in my office to be managers of the IPSA fund that you mentioned, India, Brazil, South Africa fund, which next week will meet to approve a new series of projects, and also the India UN Development Fund, run with our office that committed over $150 million over 10 years, most of which is being disbursed for projects in ACP countries. In addition to that, you are one of the intellectual leaders of the Global South. We are proud to be partners with RIS every year, organizing the daily process where think tanks from the South get together to reflect on how to build more South-South cooperation. So really thank you again, Ambassador, for the great contributions of India to South-South cooperation. And what are the challenges I think we have? One is, I think all of us around this table are convinced that South-South cooperation exists, is good. Even in advanced technologies, we put together a human development report, my office did, on the impact of fourth-generation technologies in development. I invite you to have a look at it, and if you have any suggestions, send it to us. But we are committed, but we have to find languages to convince others to join this process. There's still, in many of our countries, a sort of inferiority complex that we cannot share, that we are not in a position to put our practices at the disposal of others, that somebody else is doing it better. Also, we have the institutional limitations I mentioned at first, that even if we want to do it, those of us who have cooperation agencies generally have them to receive collaboration, not to organize our supply and the delivery of that supply to third countries. Also, and I think this is one of the the deepest challenges that is the one I discuss most with political leaders, which is how do we convince the people from our countries that by definition are developing countries with a lot of needs to commit resources to help others. Why do we have to do that? In that I'm inspired for what the colleague from Guinea Equatorial said, that you decided to do it, that now that you have some resources to, in a way, pay back to the assistance you receive over many years. That is one formula. We have to find others, too, that apply to different contexts, to mobilize our societies, even in the countries that, as I mentioned today, have strong and serious limitations, because everybody is in a position to share something. In that context, we want to we'll take stock of what was said here, and I look forward to receiving the summary of the deliberations, and really are open to further partner with ACP to do more, to get more countries, more organizations, more academic institutions, more private sector actors, more scientific organizations engaged in South-South cooperation. So we look forward to partnering with ACP in that respect. Finally, let me say that today is probably one of the last official events of Secretary General Gomez. I remember, as he mentioned, almost 3.5 years ago, when we were meeting for the first time in another room, signing the MOU, and we promised ourselves that it will not just be a paper declaring our friendship, as beautiful as that is, but it will lead to some concrete actions. And we have some concrete outputs already, the publication that we have outside.
This one.
And correct, the publication that we put together where ACP showcases as part of our South in Action series what it's doing. And this event, I think, is a crowning symbol of this partnership, where I think you leave an organization, a secretariat, and ambassadors strongly motivated to do more for South-South cooperation. And with your permission, I want to give Ambassador Gomez a little token of our appreciation, which is this. This is a very simple present, but I think very symbolic. Is a scarf, if you want to wear it as such, or something you can hang on your walls, which has the symbol of South-South cooperation, which are the circles there, you see in the corners, and hidden in all the circles you have all the 17 SDGs. So it shows, and I think it symbolizes your commitment, Patrick, of putting the institution of the ACP to build a better world. So thank you very much.
Thank you very much.
And the pin. And the South-South pin. Which you can wear.
I put it on. Put it on later. Thanks.
Thank you very much.
Thank you very much, Your Excellency, for those closing remarks, and also for those kind words extended to Dr. Patrick Gomes, whom, we don't even want to think about his leaving, because he's been working so, tirelessly on behalf of the ACP, and I'm pretty sure that he would continue the good work that he started here in Room C. I now give you the floor, Mr. SG, to give your closing remarks.
Well, thank you very much, Madam Chairperson. I wanted to say, who better than the chair and the ambassador, whom I've always been greatly admiring, the calm and the sense of purpose that she brings to her work. So I'm very happy that, in fact, my last official event can also be at Jorge. We did say we will not just talk and sign a piece of paper, but we wanted to do things, and that is the publication. But even the bigger thing, I feel we have to put on record the appreciation of the government and the people and the president of Equatorial Guinea. That is not only a publication and an idea, but an institution. That President Obiang, when he addressed us at that 7th summit of heads of state in Equatorial Guinea in Malabo, he said it's time we should have our own institution in the South, for the South, and promoting South-South cooperation. Please convey again to my dear friend, President Obiang. I think that is also symbolic, and I'm overwhelmed by the knowledge, the wealth of experience. Every time I meet in this room, I'm enriched. I too now have a great debt, a debt of gratitude to pay for what you have given to me. If I have given something, you've given me 10 times more than that. But today's event has been able to identify some factual issues and also how we intend to be actionable in following up. And one of which that is very, very important for us to follow up on is, of course, the UN Galaxy platform. But in addition, our special guest in the chair, ironical or historical as it would be, we Guyanese together, and now Guyana chairing the G77. It is, in fact, not only an honor that came from somewhere, but we want to continue that, and we want to say that given the indication of the ACP playing a role in the South Summit in Kampala, the president in office of the summit of the ACP Group of States, President Kenyatta, will be more than delighted. We would like to see if we can pursue him addressing that South Summit. So we will follow up very much on the invitation to see how we can play a role. We've already identified, am I correct, ESG, that we have identified some money in a technical assistance program for the South-South cooperation, something tangible? Yeah. Thank you very much. We do have, under the 11th EDF, an allocation we can make available to be supportive of the work of the chairmanship of the G77. So we intend to be very, very practical, and also to see that this is a process, to see it's almost a process and a movement by which we have to bring the Global South in terms of looking at its own resources, its own talent, expertise. The innovation that is being pursued in Equatorial Guinea by UNDP is highly commendable. The link with the science too, science, research, innovation, is a key pillar in one of our cross-cutting themes that we will be introducing into the new agreement, a 25-year agreement that the ACP will be entering into with the European Union. So these things are coming together for a cumulative impact. And we therefore must see the system in its holistic way. That is how the sum is greater than the sum of the parts. And the parts that you have played, I believe, are very significant in coming to the ACP, because we are a catalyst. We're also a hub and a facilitator. And this entire armament or admiralty of how we are confronting poverty, we will continue to remain, and I'm sure, not only in my successor, but because the permanency of the Committee of Ambassadors who are here, the distinguished talent and expertise, will ensure that we go to a higher stage and a higher step. And I think with that in mind, I look forward very much to hearing and being part of the great work that will be done in South-South and Triangle cooperation. So thank you very much.
Thank you, Secretary General, for those remarks. I think colleagues would agree with me that this is one of the most important meetings that we have organized since we came back from Nairobi. And Ambassador of Kenya, you will bear me witness, when the president in office of the ACP summit mentioned his priorities, he talked about deepening multilateralism through South-South cooperation, and that the political commitment he would endeavor to assist us in ensuring that his colleagues also give the ACP the recognition it required. And I believe that through this symposium, we have been able to go a step further in deepening South-South cooperation. Since this morning, we have heard from various partners on how we can leverage on the opportunities that have presented themselves through South-South and triangular cooperation, throughout various countries, through institutions, through partners in third countries. And I take a leaf from the statement made by Mr. Shedek here this morning, when he mentioned that we all have something to offer, whether we are small states or large states, or whether we are rich or poor. We can all offer something to each other. And I believe this is the spirit that we should take from this summit, that there is something that we can do collectively together. I would not attempt to summarize what has been discussed here this morning. The Secretariat certainly would come up with an outcome document which we would share with everybody. But suffice it to say that we have set a platform that we would all make sure that we execute in our various little ways. The group of 77 and China represented here has made some very important comments this morning as to what they're doing in deepening South-South cooperation. We also heard from the special representative, again, echoing what we're doing in terms of deepening our collaboration in the achievement of the SDGs and important issues that we all share as ACP countries and also collaborators. Of course, we are also starting afresh in deepening our collaboration with new partners, India, Peru. We have Cuba as a member of the ACP, but making long strides in terms of deepening collaboration in various areas, including in the health sector. We have also heard from important partners. The professor mentioned this morning or this afternoon here what they're doing in terms of innovative science and health. And I believe these are things that we can sort of put together, and it can provide some sort of a work plan for the center that we have in Malibu. And I'm glad that the UNDP, who is already partnering with ACP through an MOU, has already set up some sort of work plan that they can engage with the ACP and the South-South Center. So I would not take up much of your time. I would want to thank all the presenters that have made some very good presentations today, and all the participants for the very useful information sharing that we have had since this morning. And I know that this dialogue would continue beyond the corridors of this meeting. Certainly, it can only enrich us as ACP member states and also as people of the Global South, that yet we have a lot in common. We have a lot that we can share. We have a lot that we can achieve for our nations. It was mentioned here this morning that this being the 75th anniversary of the United Nations, I think it's a point for reflection to ensure that the principles of the UN are actually safeguarded and enriched, and multilateralism, which we all agree that is under threat, can actually be strengthened and safeguarded through the partnerships that we are forging here today. And I want to again thank the ACP Secretariat and Mr. Gomes and your team for working very hard to put this workshop together, this seminar together. I know it's been very difficult because this is the last minutes of your sojourn here in the ACP, yet still you found the time to make sure that you commit to the program that you set out for yourself. And for that, we really commend you for the hard work and the dedication that you have put in. Certainly, you are going out with a big bang, and we shall really remember you for that. For the team, the ASG, Dr. Banks, and the entire team behind here, I really want to thank you very much for the very hard work that you have put in putting this important seminar together. I would also want to thank all the moderators for eloquently and very ably moderating all the sessions. And certainly, of course, I would not forget all the presenters that gave us some very good insights into the work that they are doing and sharing very important ideas. Certainly, the outcome document which the Secretariat would prepare would be shared with all of us, and I'm sure that it would give us some very important pointers as to how we can deepen our cooperation for the interests of all our countries and our citizens. I thank you so much for your attendance, and I look forward to our future collaboration in deepening South-South cooperation. Thank you so much. Let me also thank the interpreters for being so very patient with us. Thank you so much.